Now for next sessions, I hand over the charge to Dr. Amar Kamble sir. Dr. Amar sir.
Yes, ma'am. Now, after completing today's first five sessions, now we are moving to the uh, sixth session of today. The topic of this sixth session is New Horizons of Ayurveda Industry. And for conducting this session, we have the coordinators, Dr. Pallavi Pardeshi ma'am and Dr. Siddesh Waje sir. Dr. Pallavi Pardeshi ma'am is assistant professor in the Department of Dravya Gun in Bhimashankar Ayurved College, Mansar, Pune. And Dr. Siddesh Waje sir is associate professor in the Department of Kaya Chikitsa in Murlidhar Ayurved College, Rajkot, Gujarat. So I request both the coordinators to take the charge and conduct the session.
Thank you, Dr. Amar Kamble sir. Good afternoon, everyone. I am Dr. Pallavi Pardeshi. A warm welcome of everyone in today's last session of our sixth national conference, Attack-on 2024, New Horizons in Ayurveda. Now, first, I would like to invite. Now, first, I would like to invite today's our chairperson, Dr. Rohit MD, PhD in Rasashastra Bhaishajya Kalpana. Sir, currently working as a Dean, Sri Swaminarayan Ayurved College, Kalol, Gandhinagar. Sir has expertise area in research, Ayurveda pharmaceutics, diabetics, pharmacology, and integrated approach. Sir also working as a PG, PhD guide in different research projects. Sir had published 56 index and 2 non-index articles till date. Once again, I welcome Dr. Rohit Gokan sir in our today's session. Now I would like to invite today's our co-chairperson, Dr. Amit Jain sir. Sir currently working as a professor in Rasashastra Bhaishajya Kalpana department at Siddhakala Ayurved College, Maharashtra. Sir awarded as an international based researcher in 2024. Sir has published many papers in different national and international articles. Sir has expertise area in preparation of different rasa aushadhi such as Khalviya Rasayan, Vasant Kalpa, Parpati and Pottali Rasayan and etc. Sir also organized international and national workshop on hair oil, Abhyanga oil, Udvartan Churna preparation. So once again, I welcome Dr. Amit Jain sir in our today's session. Now I request Dr. Siddesh Waje sir to invite and introduce today's our eminent speaker, Dr. Ajit Lingayat sir. Thank you.
I would like to introduce today's guest speaker, Dr. Ajit Lingayat sir. Sir currently working as a associate professor and technical expert pharmacy in Department of Dravya Guna, Shri BMK Ayurved Mahavidyalaya, Karnataka. He has total experience of 15 years in teaching field. He also has a vast experience in a field of Ayurved drug manufacturing. He is a member of an institutional ethics committee for animal study and also working as a coordinator institutional allied subjects in Sri BMK Ayurved Mahavidyalaya. Sir is also PG co-guide and co-investigator in different research projects. He has published 12 research articles in peer-reviewed national and international journals. Sir has been invited in various seminars as a resource person. I request Dr. Ajit sir to start the lecture. Ajit sir.
Yes, I'm sharing my screen. Is it my slides are visible and audible? Sir, I'm audible to you?
Yes, sir.
Hello? I'm
Yes, sir.
Okay. Okay.
Yes, sir.
Good afternoon to everyone. Thanks for giving chance. I put my thoughts conference. and this is a very good conference. I feel that is I also joined in some lectures on, and I seen the different also that required for the treatment purpose. As I am a pharma person, I'm going to put forward the new horizons for the Ayurveda industry. As this is from recently, this was the new updation. I want to start with my some updations to you that CCRS is launched at Pragati 2024 regarding quality Ayush products is fundamentally root of rigorous research, and they're underscoring the importance of developing research-based and high-quality, safe and effective Ayurvedic products. That is very important thing. They are working in on that because recently we are had DMRO, that is Drugs and Magic Remedies Act, in that around 38,000 cases are seen or the advertisements and lots of things are come, and product quality which is going to be ensured. And also I seen in morning that our CCRS director, he told that they are around have enable labs and NABH hospitals where they are conducting all these things for seeing the quality of the product. That is very important. And also recently that Aish also made MOE with the BAIS, Bureau of Indian Standards, to make our protocols to be standardized, and therefore quality product give definitely quality results. And we are already knowing that because it is we are since 5,000 year ago the formulated, and still result. There is no changes we are not seeing. There is no problem in that problem in the therapeutic efficacy and all. Therefore, the quality product we are keep that quality. Therefore, these things are there, that we are going for the tradition technology innovation what we are also following here, and the tradition because we are already having 5,000 years background of that our all samhitas and all those things are there with us, but we have to go with the technology to make it more precise and give quality products to the market. And from that, by technology and the traditional knowledge, we have to make some innovations that can develop a new product to be customized to the requirement of current practice. First of all, our Ayurvedic doctors, there has to be take care, they get that product with good efficacy, but it should not alter our principles or the base of the Ayurveda, or the quality of the product should not be changed. That is very important, and it should be again equally safe for the people also. That is, we are going to be seeing the photographs. Lots of instruments and equipments are used right now currently in the industry. As we are go with the Ayurveda, we are having around 5,000 years ago, and we are working majorly with the holistic approach of compassing mind, body, and spirit. In that, we are emphasizing major, very important thing Ayurveda is having that prevention and then personalized treatment. That is very important. We are having prevention. That is a good thing because we have that kind of medicine that can be prevent lots of diseases. Okay, that is we are going to be best example what we gone in Corona, that is Chonprash. Then Guduchi, that we can also extensively popularize in that, and this can be used and prevent the disease, or it can give the immunity to the body that can be fight for the current disease and disorders, because the current world is going on with the disorders rather than diseases. Therefore, there is no that much option into allopathic medicines to treat the disorders, and that is one of the big approach to the Ayurveda products that can be maintained very well. Our roots are come from the Vedas, that is Charak Shrutashtram, and also one of the Sharangdar Samhita, which is especially for the our medical medicines that can prepare in Ayurvedic classical medicines, majorly how to their things, what are the different dosage forms and how they prepare, and their how to make it quantity and everything that can be come from that particular there from the Samhitas. The core principles we are working on that, that is Tridosha, that we are telling, we are claiming that in Tridoshas, and we are having that if it is imbalance, if there is a disease and disorder, we have to keep it in a balanced manner, and we are having that products in that. Therefore, this is one. Another thing is Panchabhotik. That is very good thing is there because all products also Panchabhotics we are there, and body is also Panchabhotik that we are going to. And also there is one Panchabhotik Chikitsa also there. The people are practicing with that, and also they are preparing the product in that concerned particular thing, that how the particular product in a predominant of that Panch Mahabhutas. Like we want something Bhuta is more, how to add it, how to prepare. Even the classical preparations, they are working on that, and they are preparing, and they're really working and giving very good results in that particular thing. Therefore, all our principles, what we are claiming, what we are telling, or we are seeing and observing and practicing, that we are also transforming to the medicine. That is also there, where industry is working on both angles, because majorly right now the industry is working on the chemistry or chemical angles, where they are seeing that particular secondary metabolite which can be have action, that will be taken more importance in that. But that is the good way. But there is one thing is there where we are speaking out our principles. These we have to taken care in the industry also. But there is a academia industry interface is very uh, slow, or it can be very poor, or it's not that much. Therefore, we have to come forward, and we have to come with the industry and tell what is our requirement and how the product should be. The much better option to the industry to make prepare the products with this Panchabhotik or whatever requirements are there from our angles. Again, there is a Prakriti, what we are telling, the individual psychophysiological makeup and determined conception remains constant throughout life, because there is a, as we are want to preventive, therefore we have to know our Prakriti and we have to adopt our lifestyle. Again, we have to adopt something which is help for to maintain our Prakriti, or we have to balance our healthy life. Therefore, the influence all the physical characters, mental tendencies and diseases, and this we are going to be getting problem from their end. That we have to see in that angle. Therefore, so knowing our Prakriti as per their product preparations, again the product should be come with the prevention and treatment both angle, both will be there, and then we can have the good product can be treated with various disease and disorder and keep healthy the people. This is our diagnostic. We are having diagnostic criteria, that is visual, touching, and details of history, taking assessment, pulse, catheter, observing tongue coating, checking eye health, dosha imbalances, assessing digestive health. The last point is there, the digestive health, that we have to having more precises there. Then treatment approach, we are having Shodhan, Shaman, Rasayana, Vajikarna, and Sattva. That is, we are having as a Shodhana treatment, and lots of medicines are prepared for this particular thing. That we are going to cleansing and detoxification of their giving to that woman like Shamana, we are using lots of herbs there, and diet also we are prescribing the lifestyle. Rasayana also very important thing. What right now Avla is taking longer time. Lots of Rasayana treatments also taking for that particular thing. And another thing is Vajikarana, that is improving reproductive health. That is because of stress. The stress is the major factor as current world is going on, and where we are has to work on that also, and other uh, our healthy life, not good habits of the regular regime, which is not there. That we have to affecting these things, and psychotherapy, mental health. As the previous slides, previous presentation, our principal sir is telling the lots of mental health issues and how we can treat the different medicines. But we have to take care that medicine should be appropriate and prepare with the appropriate manner and with good quality that can be heal up. And in the modern, what we are correlating, that is holistic approach, because we are treating entire body, not a particular disease or disorder. What I observed in my 17 years of my experience in this Ayurveda, and that they really, and we have to treat entire body, because we have to make a healthy person, not a particular symptoms to be subside or something going to be removed. Therefore, the personalized medicine we have to individual for individual constitution, that will be preferred. But we are there is only one thing is there. I want to suggest here, because we are having very good width, because we are going to be individual medicine, personalized medicine measure, where the industry is having not cannot be do all the personalized medicine. They want something some common medicines, or we have to make it something common medicine. Can we use it every person? That we have to take focus on prevention health promotions, because preventive aspect is very important. And as we are having lots of medicines to prevent the disease, and we are giving prophylaxis as Ayurvedic colleges with some medicines every area of part of India, and there we are giving some medicines to them. Therefore, that prevention aspect is there. We have to make it such a way that industry is already working on that. We can approach, and there is one thing industry can give large scale production. Okay, that can be fulfilled. Hello, large scale productions, and that can be from going to be touched to each person of this globe that we can industry can help us, and they are having that capacity to do, and complementary with the modern medicines, because very chronic diseases or something with diabetes, something people are taking some allopathic medicines, and after some Ayurvedic treatment, both with going parallel with each other. That time also we are having a good approach by the industry, and industry is really working with this. See how we can integrate the both things, and we can have, because the allopathic is having more major side effects, where Ayurveda is having very less side effects. Side effects are there, but very less that we can have, that we are going to be seen. So scientific overview, increasing research in interest in Ayurveda concept in treatments, because there is a day by day research is going on. As I told, there is a industry academia interface is required, because around India is lots of PG centers, PhD researches are going on, but they are not translated to the industrial level. They are going to be have their own researches, but not translating, because they cannot be come to every person, because industry should get that time, and that I feel that Ayurvedic colleges should come to the closer to the industry and ask and clearly spell out what they want, or whatever industry is having can be done it in that fashion also. We have to think of, because if you give good depth of the industry, we'll get good volume, and we can definitely reach to the each person. That is one important thing is there. Again, clinical trial validation, efficacy of Ayurvedic herbs and formulation. Right now, there is a Ayurveda, all medicine should have clinical trials, safety studies to get approved from the FDS. Okay, that we have. That is very mandatory done. And recently, we are having quality. Also, there is stability studies also added by the FDA to compulsory done to the particular product of any proprietary medicine. There is a classical medicine not required. That is, this kind of rules and regulations are coming very stringently with the regarding quality of the product, and industries cope up with this, and they are developing the studies of the Ayurvedic dietary principles and their impacting on health. Because we are having our dietary pay among the villages. These are these instant food also come into the market, and they are having good results, and they are working with this, because people want everything is instant form. We are working, but still how it is there, translated or not, any corrections are there, we have to come back and we have to give feedbacks with to the industry again. Research on mind body therapy like yoga and meditation, because yoga and meditation, they are more popular, and wherever the yoga goes, the Ayurveda goes in back to back with this, and Ayurveda is also having popular with the therapy and accepted by the around globe. Therefore, we have to work with along with this also. The challenges of these particular scientific validations are standardization of preparation. Rather than standardization, I'll tell some quality parameters what we are selecting, because lots of quality standards are given by our classes like Bhatma Parikshas, then regulatory characters and all what we are given. We have to keep that is the first standard. Apart from that, we have to develop some chemical standards that can be comply the classical standard. That is very important. We should not come with the chemistry to Ayurveda, but we have to go to Ayurveda to some physicochemical or chemistry part. That it is much important, and that will be remain good quality product, and that can be acceptable by the all Ayurvedic doctors also. And research methodology, bridging ancient wisdom and modern science. Whatever modern technologies are coming up right now, the for example, we are taking kashayas. Kashayas will preparing by some gas and all, but right now the kashayas are preparing by the steam. Like lots of modernization is going. Tablets are coming with the punching and with binders. Capsules are come out. Soft gels are come out. So these are the new formulations also come out, and the Dhanavati is also coming with good quality like that. But we have to uh, take care whatever Ayurvedic principle, Ayurvedic standards of the product should be remain same in the product. The research areas where we are going to be pharmacological studies of the Ayurvedic herbs, because right now the basic challenges is the herbs, because herbs are getting endangered day by day, and whatever the herbs are there is a major challenges with the their adulterations and substitutions, that we have to identify the particular substitute, or we have to stop the adulteration. And another thing I want to clear here, the herbs which is explained till Bhav Prakash, it is only acceptable by the FDS. We cannot use any herbs, and we cannot claim it as any herb or any species which is not explained after that the Bhav Prakash as per rules of Drug and Cosmetic Act. Is it not Ayurvedic drugs? They are not giving. Clinical trials on Ayurvedic formulations, stringently they have to taken care. And all Ayurvedic, actually Ayurveda colleges are the best CROs for the industry. That we have to come up and give particular things to the in the industry knowledge, that because there is all experts are present in all Ayurveda colleges, all departments actually. They can be give good inputs to the industry to make good products, and their products corrections are there. Genomic studies of the correlating Prakriti and genetic markers, like after treatment, what will the changes will be happened, or after taking products, what are the changes. Investigation of the Ayurvedic dietary principle, or as we discuss in Ayurvedic dietary products, or any diet products are there, how we can make it good products out of that. Research on Panchakarma, detoxification therapies, because Panchakarma therapy is one of the vastly used, or it can be worked in the treatment part, where lots of medicines are required in that, where we have to research that particular thing, what are the products measure we can do, how we can make it the current product, how we can upgrade for the more therapeutic level. Then we can have, because some instant busties and all lots of things are going on into modification into product, but they may work or may not work. That is one of the things are there. But currently, the doctors want whatever is going on, they want to upgrade themselves. That's in the product. The studies of Ayurvedic management of chronic diseases, because lots of chronic diseases like arthritis and all that will be we are doing. And again, there is a lots of things working in the chronic disease like diabetes, arthritis, mental health, then Vajikarana therapies. Lots of drugs are there, but new drug every day, every time will become. But we have to stick on some drugs where we are having good promising results. We have to go into depth of that. Again, we have to make where they are stucking, how modifications are required. That can be, because in Gokshur, it is Shilajit, they are working in the very much in the Vajikarna product. Again, lots of good products are coming with this, where we had to make it some modifications or something new things. They are going to depth and use everywhere. The notable scientific studies we are having right now, the working as I discussed in the secondary metabolites, that almost all herbs are screened by the pharma peoples regarding their activities. Almost, which is every drug, almost drugs they are working. For example, they are from that we got colchicine, and it is very good in goiter, that is isolated and used by the modern peoples. There we are a curcumin is also there, but that is not isolated part is not our dish, because we are working as a drug as a whole, and very good thing, because of drug as a whole we are having very minimal side effects. That is very important. And rather than when we are fractionating the drugs, right now extract era is going on in the Ayurveda industry, and that they are extracting so many things of the drugs, and they are preparing the product. But there is a restrictive particular efficacy is there. That is very important thing we have to come up. And the research in ashwagandha, that stress reduction and cognitive function, that is itself that I shown in my slide. So how many brands which is available on the ashwagandha only. Every company is producing their capsules, something powders, and that they're selling, and some extracts are there. So people are having extensive usage of the drugs in a different forms. The investigation of Brahmi, that is, we are only just Brahmi is knowing for memory, but again, there is a lot of good efficacies of the Brahmis are there that should be explored, and there is a research, is lots of research is done into Ayurveda colleges that should become and translated in the industry actually. The challenge is research, that is standardization of herbs and herbal preparations. That is one we have, because standardization, because we are not getting the drugs. One thing, second, we are having the quality control standards which is available in the industry, and industry is having their own standards also, because that is one thing I want to share, because industry is not having their only dependency on the pharmacopoeias or standards available with them, with the literature and all. They have developed their own standards. The how much the secondary metabolite percentage is required into the drug, they are make it ranges. They keep it on the particular one chemical marker for that particular drug identification or quantification quality of the drug, and design appropriate clinical trial protocols along with the doctors, Ayurveda doctors, and they are doing this all those things. And but there is interface is very less. The integrating the traditional knowledge with the modern research methodologies, because all the we had to integrate with this new technologies and all. because the things are available in the world that we want. We want particular machines, are they available? Artificial intelligence right now, network pharmacological and molecular docking is also coming to see the particular chemical is having how much action into the, we can predict the action in the body, whether there is having good receptor actions that we are going to be also have. Means that much we are having this much facilities, and that can be used, and we can make a develop good products, and that can, because as I told, there is a good width is there for Ayurvedic products, because everybody is saying that this one hair oil will become, the another person will start the new hair oil. Okay, like that there is a good width is there, but how much that combination is giving good results and all, that should be taken care, and we have to come up and spell out clearly to the industry this has to become, and the funding constraint and limited research infrastructure, because there is one thing is there, the industries are majorly with micro and small medium and have some large scale also, their funding constraints also there, but again we can collaborate with the colleges and research institute, that CCRA is having lots of patents and all they taken, and they are researching new products, but they are not in a market, they are very much restrictive with them only, they are not coming to market, that we have to correlate with collaborate with this, and we can bring it out, and we can use it much better way. Then IPR, the benefit sharing issues, because very good products are developed by our researchers in PG, PhD studies. We are also seeing in our colleges. Again, right now the good things are coming with the CCRA, that is Spark and Smart project. They are developing a small pilot data with this, and that can be utilized. And but there should be IPR rights and benefit sharing should be there, and industry is ready. Actually, industry is ready with this all those things, where we have to approach with this, and they are doing integrative and with modern medicine, that is complementary approach, because we can having Ayurveda along with that conventional treatment, where we are knowing or not knowing, the people are using both medicines, and because people are, if you are they are telling we are taking this medicine or not, they are not come open is also, but sometimes they will come. The integrative combining approach with allopathic practice also there, and very important thing right now, the emerging this as uh, cancer, like the disorders or something, diabetes and all, as we discussed, there is this supportive therapy, as Ayurveda is having good treatment. Sometimes Ayurveda is having good treatment for some primary stage also, and we are seeing in our, because we are running a cancer OPD where they are developing a new products every time, and they are working with this, and very good supportive therapy we can give it. The mind body technique for the stress management and medical conditions, we can develop a product, because every morning it starts with a cup of tea, where people are taking right now the very new thing, that is herbal tea, because they are taking, and they are using that, some they are getting good results and working with that, like that. And the lifestyle intervention based on Ayurvedic principle, because very much the products are developed, but the lifestyle is not remain changed, the that we have to taken care, and the product development is come along with that, and we have to educate the person to using that particular medicine with their lifestyle. The Ayurvedic pharmacology, as a repository of 700 medicinal plants are kept, with around 5,000 medicinal plants, which is used in Ayurveda, different formulations. It is extensively used in our particular classical medicines. The proprietary medicines, they are very much less, the ingredients are there, but more in classical medicine. They are complexion, for complex formulations. We are having the procedures are high costing level, that is decoctions, that we are having oils and all. But again, the emphasis on synergetic effects of the herb, their results of the effect of the herbs into with the formulation into therapeutic efficacy is there. Traditional processing methods are enhanced the efficacy. As we are telling, we are there in industry, the traditional methods are also following for get good results also. But sometimes the drug is getting denatured with the new technologies. For example, we can take it as a kashaya, we are preparing the steam and all. Whether there is charred, or there is a many chances of we cannot, because in bulk production, the control on the quality of the product is somewhat difficult in that fashion, and they are working with this. The potential new herbs of discovery based on Ayurvedic knowledge. There is one thing thing is here, we had to brought a new drug, that is extra pharmacopoeial drug, or you can, the drugs which is not approved in Drug and Cosmetic Act, the new drugs, we had to bring it in the Ayurveda with setting their all classical things, means the requirement of Ayurvedic, that is Ras Panchaka and all, that standards we have to set, and we can brought it into the Ayurvedic practice. That is very much needed to substitute a old drug. That is very much important because lots of drugs, best example is Ashoka, where the slow growth rate of that particular drug is there. Growth rate is very less, but a product, the drug is used extensively in the Ayurvedic product, but we have to substitute with the new drugs. But like right now, polyalpha is there, but still like that, we have to come up with the that drugs are having majorly with Himalayan regions. That is Ativisha, that is Trayamana. These are drugs are very rare endangered, and they are not having presence there. But with substitution should be 100%. At least that give the results what the original drugs given. The three that I just given a five examples, that is turmeric and ashwagandha, amla, brahmi, and guglu. That is one of the highly consumable drugs. Another drugs are also, that is dashmula, and they are highly consumable drugs. These are the five, and there is lots of researches are done. That is anti-inflammatory, antioxidant, everything. It is done on the animal studies and somewhat in a clinical studies already done and conducted, and we have to utilize that part in the industry, and we can make it a good product, and we can bring it a new product to the our therapeutic efficacy level. What industry facilitated actually? The industry is facilitating, first is production, major part. Industry is working on that only majorly. They're also working with the research and development. The industry is always research and development on the product requirement. What is the product lacunas are there? Majorly, when the products are coming to market, they will always see the how the drug is affecting and where is the drug is stucking, because they have to correct a new version of that same drug. That is, they are working on the research and development, coming with the new drugs with the new requirements. That industry is also looking for that, and they are working on that. Next important thing, they are working with the promotional activities. The industries, some industries are only for marketing purpose. They are working, they are taking the products by the other industries, or the doctors, or the person who is manufacturer having license. They are only doing the marketing work. That industries also look after that. One person is manufacturing, another person is promotion. The very important thing, industry help us into regulatory compliance, because once we want to export the products, we want to give products to the other countries and all, their regulatory compliance are there. Again, some products when we are selling into the market, there is a very important thing, the regulatory compliance is there. The product is containing something heavy metals, or sometimes it is containing afim and all. That level regulatory compliance is required. And recently there is a one thing is there, the NMPB, Ministry of Ayush, last 1 year back, they are told that the product having afim and all, that should be surrendered by the industry. That is very actually not good for the us, but still they issued one letter for this. It should not be there, because some very important medicines like afim and all, that is required for therapeutic purpose. What is a man? First, we start with the manufacturing. How the products. The industry is working with the medicines, because all Ayurvedic medicines are products are classified under medicine. We are working with the two major is classical and proprietary. In proprietary, we are having medicine, Balya, Koshak, and Saundarya Prasadak Vardak, like that. They are having categorization under that. And another one is OTC product, is also same, which is come under medicine part only. That we are going to be, these two things are produced by the industry. Right now, industry is shifting slowly to the OTC products. Medicines are slowly there, but they are only for common alignment, because that industry, because that required good depth and good requirement. Then only industry can work with this. That we have to see. These are the leading brands of the right now current era. That is, they are working. There is lots of around as the last data is there, 10,000 pharmacies are registered with the Ayush, and slowly the Ayush is working with the e-Aushadhi portal, that they has to come up on online. That is very good thing. The Ayush is coming, and they are making, because there is a brand names are duplicate is there. lots of things are it is illegally selling, and the company who is registered, who is the owner and everything, they want to everything, and the products, ingredients, what they have, everything they are coming with the clear picture with the Ayurveda industry. Because right now uh, we are having almost some Vaidyas having their own pharmacies also with license. Really, there is good thing they are developing products, but they have to have one big company types. They can be promote much faster the product, because that is there, and all confidentiality is maintained by the industry. IPR, as we discussed earlier, everything is done, and that can be. Right now, the Patanjali is having good requirement of contract manufacturing. That is, Patanjali wants to manufacture their products with at different places, because every herbs is not available at their place or required place. They're having their own habitats. Their Patanjali is known, and they're working. Right now, this is working with the our lots of companies. That is Himalaya also working. Right now, Dabur is giving own plantation materials to the peoples to plant the drugs and take back to the manufacturing. They are coming with such solutions. As we are working and we are knowing that our some classifications, that is we are having uh, just majorly with oils, churna, aswaristas, bhasmas, then kupi pakwa rasayans, fish teas. These are some classical preparations, and really all preparations are prepared by the companies very well. They are in a product, some leading brands like Dutta Fisher, Ayukal. They are having good mineral preparations. They are come up, and they are in present in the for the doctors for usage. But what are the requirements? And there is some, we have to think of the new changes in the classical preparations also. We can done with some deviations, but it can use good products that we have to think of. Also, we are going to be see the modern adaptation, because as we are having some issues of limitations with the uh, classical medicines, their stability, we can say, we are having that, just like churna cannot be stored, then extracts they are come up with this, like that. There is modern adaptations are there, capsules, tablets. Then because of bati and gluti is not having uniform dosage, unit dose is to be prepared, then tablets are come up. Like that, extracts we can standardize much faster, and we can do it very good. Like that, adaptations are also done in the industry, and they are working. The importance of the proper preparation and combination of the herbs, there is very important from, and there is very good inputs from the Vaidyas are required. When the preparations are come out, they are having proper combinations of the herbs or not. That advice is very important with the, after it will comes, because clinical aspect. As we are predicting with the chemistry level, because the drug is having this chemicals, maybe give this much action. But what are the major medicines required for a particular purpose? It is prepared or not? That is very, we have to take care of this, and then the good product will become up. The quality control measures, as pharmaceutical industry is taking, definitely they are having good instruments and equipment. They can have standardize the drug, and they are giving their own in-house standards for the uh, particular drug they are giving. And right now, all proprietary medicines are in-house standards that will be given taken care by the industries only to uh, FDAs. The efforts toward the global standardization Ayurvedic medicine. Why this is there? Because we have to go with the global. The product is going right now export. Right now, our we are coming with the current scenarios in next slides, where we are having around 1.2 lakh of turnover of the this industry is there. And this one comes to the other country, they are telling that they are containing heavy metals, something pesticides, something fertilizers. That is there. How we can have overcome with these issues? The industry is working with this, and industry is definitely come solutions for that, and they are doing. But there is no change in our product principle. That is very important. Right now, we are coming with the new preparations. That is one of the major preparations, that is syrups. We are working with this, and with this, we are having 60 to 85% of the sucrose and flavoring agents and medicinal substances are there. We are having syrups for all purpose right now. They are in market. And another mixture, that is we are having oral administration of the two are dissolved or suspended material. We can make it two mixtures. That is, we are one of the benchmark product what I seen in this, that is Suvarna Prashan. And seeing the examples, that is Suvarna Prashan, because Suvarna Prashan is right now popular in entire India, maybe in other parts of the country, other countries also. But I observed that is Suvarna Prashan because it is practiced everywhere in almost all Ayurveda college, Ayurveda hospitals. It is practicing, and it will be accepted very well in the people also. Then elixir, they are having a sweetener and hydroalcoholic solution without medicinal substance intended for the oral use. Here, hydroalcoholic extract, because hydroalcoholic extract studies are done very much into the all pharma and Ayurveda PG studies. I observed that, but still it is not translated into the practice. Lots of researches are done, but they are not translated that much what we come up. That is, we have to take see that one. Linctus, that is the viscous liquid oral preparations that are generally prescribed for the relief cough, but those small volumes of the 5 ml that we can get it a prolonged emulsion actions, they should be taken undiluted and sit and solid slowly. This is the requirement of the particular requirement of the conditions like cough and all to develop the products. And we are having also products in that conditions also. I have taken one example, one examples which is we are seeing in the slides. They are of the Ayurvedic licensed product and they are selling into market. Another important, that is lotions that will be in a local action for the cooling, smoothing, and protective purpose. They are also having alcoholic and aqueous. And another important thing, I will give information that under 158B, the Gan Cosmetic Act, we can use it any extract, but we have to use whole extract. We cannot fragment the extract in a particular marker. But there is one tricky thing is there where we can only isolate some secondary metabolites like alkaloids only for antimicrobial actions, tannins for anti-inflammatory actions. Can we do it in another micro level? And our FDAs and our pharmacopoeia can give permissions for that. And the things are coming very soon in the pharmacopoeia that one herb, one nation, that principle, they are working with the that, and on very soon it is they are publishing around 8 volumes on that. That 5 volumes are they are publishing on the Dhanvantri Day, and they maybe come up. And these are the things are there where we have one standard, one product, and therefore GMP is come into existing 2000 and 2003 it is enforced because of we have to uniformity into product. So that one thing I want to share. The liniments that we are having liquid preparations, again it will be very good form which is extensively used for the pain, analgesic effect, smoothing and counter irritant type of effect we are getting, and they are available. Along with this, as I showed in the examples and things where the industries, you can get the idea that industry is having all advanced technologies with them. But the only thing is we have to cope up with this. The gargles, aqueous solutions used to prevent throat infections and available in concentrated form and diluted with the warm and warm water that we can use it. Already we have some classical kashayas also use it for the gargling like that are there, but things are working with this also. These are aqueous that mouthwashes, another form, and therefore I keep it one good example of Colgate because the industry is like Colgate and that they are working with this and they are using some part of particular product or area and they are working with the good exposures and they are come with that. Sometimes the people doesn't know they are using Ayurvedic product. They are using that thinking this is something food product or something normal product or they are having the general product. Okay, but these are having Ayurvedic products. Another example is come up with next slide. That is also there. The throat paints, which is I never seen any examples in that particular. The chest, we are having the medicament solutions rinsing the body cavities. Right now, we are using kashayas and all. They are using for body cavities. Some aqueous extracts. We are working with this, and they are concentrated solution forms. We are seeing. Next is very important. That is ear and nasal drops. They are having a very good usage and products are also which is available into market. The ear drops, the solution that installed into because these are very sterile products. Very all products are very hygienically prepared. These products are very sterile products are there, and they are come up and the industry is having that product range also to a particular physician. Then eye drops, that is we are there. Eye tone is the one of the popular medicines which is used everywhere. Next is enemas. These are required into panchakarmas also. And there are oily preparation, suspension that reduce into the rectum and cleansing the therapeutic efficacy that we require. But the Patanjali is come with the kits. That Patanjali having enema kit. They have come up with this again. But the classical bhakti is there. How it is given. That how much we can make it modified to retain the timings we can increase, or what is the requirement for that particular thing that we had industries working. But there is no instant busties and all, they are not prepared. We can have, because there is a variables in the another components of the busties. Therefore the things are like that, they are having stuck on that. Another important form is their suspensions. They are biophasic liquids, and this is also very, and I given an example of amla pitta mishran. They have so one of the good products which is in that particular form. Then emulsions, that is also there. They are two or more liquids that is usually immiscible, but under specific transforming, they adopt the microscopic housing inspectors, and they are also having. This is also one of the products also available into market. The pest, that is huge are their range in that, and one of the good leading brand is Patanjali Dantkandi is there. There means lots of things, but how we can make it like Sensodyne. Okay, they are coming with the particular issues of the teeth. Like that, can we develop a new range of the test for the oral care? That we have to develop the new products in that range, and we have to come up with that product, because R&D is, as research and development is going on. As an analyst, how much we want, how we want, that we can do it and we can make it that in. Then creams, that is lubricated jellies are there. They are transparent, translucent, and that is for foot care and all that. They can be skin care. They can be used in the external. Next is buccal and sublingual tablets. That is for the dissolved relief for the pain and headache, sometimes oral care in that they are working. That products are also available with the industry. And there is a chewable tablets, which is we are having Sudarakvati and Kofal, which is one of the good brand. It is developed by in Kerala, that is Kerala company, that is they are working. That is also available with the this form. And another form is that is lozenges. That is also available and vastly using for the cough relief and the cough related issues. There are lots of lozenges are also available. Then pastils, that is their solid medicated preparation that dissolves slowly into mouth, and they are soft lozenges. They are based on either glycerol and gelatin and acacia sugar. These are some experiments they are used, and as need they have to dissolve slowly into mouth. Like that, the product is also developed for the particular thing. Next is important, that is another form is capsule, which is widely used by the all single extracts, combinations, and they are working. And again, the Xiribala one not oily things or liquid things can become into the soft gels. That like both are there, hard and soft gelatin capsules are available. Really, the Swan Prashan, we are also planning to get it in a single dose, unit dose, like soft gels and all. Like that, that is good thing. We have to make it. In aerosols, the packaged under pressures and contains therapeutically, they are having for skin and local applications, the nozzle and that can be aerosols are also there. But there is one thing I seen, that product which is applicable and use it for repellent and canned aerosols like that smoke, and we can compactly packed and we can use it for particular things. Then gases, that is we are having inhalers, and they are going to be used for the spray in the sprain and some inflammations. They are going to be worked. In inhalers, that we are already there, the combination of dosage form consisting of virtues of high vapor pressures and carried out and current air and nasal passages, where we can get it very good relief. But I put it another one, that is asthma, just like pump. Can we work in that level to the another product that we can develop the products for the another that is asthmatic conditions and all, because nebulization and all we are having some hydraulic extract we are working and that. But here we can work it in a such another range because the thing is there how much precisely we give the drug, how much customized and very fastly acting drug we can produce that will give good acceptance in the public. Another drug is there that is in solid, that is granules and powders. That is there. The powders are granules, they are sugar based. Sometimes they are having powder mixed and make it the small granules. Another is powder, the new forms that is some product with the talcum level and that used with as I put that is borderline Ayurvedic prickly heat powder. This is only for that particular condition. Like that, the product range are there and things are there. I keep it the example of people don't know, people may not know, but there are it is Ayurvedic product. If you see the backside there is Ayurvedic proprietary medicine name is there, but never I seen in the ads that is Ayurvedic medicine. That is one of the thing is there that we have to think as we are working as a R&D, that is drug discovery, that is researching from that particular it is come by the our drug that is Rolfia serpentina. Ongoing research in Ayurveda in new drug leads. We are getting new extracts, new drug effects with the new forms and new dosage forms which can give it a good results in the Ayurveda treatment. That is we are also getting from the drug discoveries that should be translated through the industries. The challenges of isolation of active compounds for the complex formulations. Here, but we cannot isolate the drug. We can have because the lots of things we are using are we are using some oils. Sometimes we are mixing two, three oils. We cannot get the exact pinpoint active component of that particular drug. We are giving bhavnas to the particular drug for the 10 times, 20 times, or like that we are going. But active component which should be there, the pinpoint active component should be isolated and get it. That is one of the complex problem is there but industry is working with that also. The potential multi-targeted based Ayurvedic energetics because our drugs are working with the therapeutic efficacy with another good supportive therapies we are getting from the drug and that will be help for the our drugs to be give good effect with minimal side effect. Very important thing we are having global acceptance with the regulatory compliance by the industry. Industry is working with the with this and they are having that because our Ayush ministry is having lots of MOUs with the lots of countries where we can have good practicing with the Ayurvedic medicines in the other countries like Europe, North America, so lots of their countries are there, and but the regulatory requirements are changed as the WHO GMP is there because we are currently in India, we are required to have GMP. But what WHO GMP help us to around 150 countries, we can directly sell the product. So that is the things are there, and the products are getting the certificate of pharmaceutical product in the WHO GMP, where we can have good export and we can have because some our doctors are consulting our overseas and they want that medicine in that particular country. There is lots of restrictions to get the medicine in that country and they are having their own rules that will be taken care by the industry and they are worked on that. Increase of integrity medicine program in major universities where we are having both allopathic and Ayurvedic medicines can be checked. Rising demand of Ayurvedic products in global market because already as we see there is a lots of demand in the Ayurvedic products because we are working with the Panch Mahabhuta Siddhant. Body is also Panch Mahabhut and the plant is also all are living things. We are working with the living work. There is no synthetic or not isolated product or isolated markers, something we are not used. Therefore, they are much compatible with body composition and giving good results. That is, we have to, therefore, the people, and again, yoga with Ayurvedic medicines and Ayurvedic practices are go hand to hand. Where there is a practice is lifestyle because the lifestyle is totally changed there and here that we have to got medicines in their lifestyle requirements, their changes, customization. Then Ayurvedic concepts to the Western audience because they are they are telling that no, mercury is having very dangerous, sometimes the arsenic is having dangerous, but the preparation and transformation of the particular product in that particular form, that the safety we have to assurance and we can have multi-centric clinical trials also into another country, not restricted to our, we can have. if the things are come with this, that definitely the product will be accepted much faster in the other countries. Regulatory status of the Ayurvedic medicines are different countries are different. Definitely because they're having their own rules, but we had to come up with that compliance, but we cannot disturb the principles. We have therefore a multi-centric with other countries clinical trials are very important for this. The growing number of Ayurvedic practitioners and training programs across the world, it is faster because they are working and they are spreading throughout the world. And integration with the spa and wellness industry, that Ayurveda wellness is also come up. Preventive health, that is we have to optimize the daily activities for the health, and along with the daily habits of some medicines and products. Rutucharya, that at seasonal changes, how we can use it, the products, what preventive and cure. The emphasis is on the proper diet, sleep and exercise, that is also there. And stress management through meditation and yoga we are doing, and then after some prescription of the drugs are there. Regular detoxification and rejuvenation, that is very important, that we have to orient about the things and make awareness for this. The people has to go with this particular procedures, because the current pollutions and lifestyles are creating issues with the health. Diet also there, we are working with the therapeutic diet. Then improper digestion is very problem, because we are eating junk foods. There is junk foods are bombarded like anything, and that will be the digestion is totally collapsed. How we can recorrect it? The personalized diet recommendations with the, or we can have some medicines that can be used. Superfoods, that is ghee, turmeric, as we already seen some products, that is moringa right now. The herbal drugs are used. Panchakarma therapies, that is we are working with this particular therapeutic efficacy in the our practice. Yoga, that is complementary with our holistic health, and we can more promote our products from that. Meditation and mindfulness, that is philosophy meditation techniques, and we are already seen in our previous principles or sites that how that will help into that. Again, some products we can add it in this. Ayurveda chronic diseases, that we are going to be have holistic approach in lifestyle, diet, herbs. We can have cardiovascular stress, because these are the chronic and very current issues are going on, respiratory disorders. Another industry is working with the geriatric care. They're having lots of good range of products for the this particular age, with the tailor-made products and lifestyle recommendations they are coming. Another area we are working with that pediatrics. The pediatrics also having good range of the products in the Arabic industry, and they are focusing on that, because the requirement is and the public demand at the consumer demands are like that. They are working. Another area where I just is working with the women health, that products are developing that particular thing. The next thing is coming with sports medicine, another area, because the requirement of and our rejuvenation, the power of our products, that when you have good immunity and body mind mental health, stress management, we can have the products we can develop, and personal training regime for individual constitution we can do it. Then cosmetics, this is one of the vast area that industry
Hello, sir.
shifted.
Sir,
Yes, sir. Uh,
hello,
yes,
sir.
hello.
Time.
I
Hello,
have
sir.
5 slides. 5 slides. I have 5 slides.
Okay.
Okay, sir.
Okay. That is we have, and mental health, because as we have mental health questions, we can develop some products for that. Autoimmune disorder, that we are having boost can be immunity, and we can have products, and already it is there. Then it major contributor is Uttar Pradesh, then Maharashtra, Madhya Pradesh, Kerala, Telangana. These are the major contributors in the industry. They are producing the medicines for that. The current scenario of this our product is, as I discussed, is 1.2 lakh crore by 28. That was good scope is there in the industry. These are the research institutes that are helping us, and another PG centers they are working with this, and we have to translate this research. And last, we are coming with the promotional activity. The industry will help marketing the product, set up the supply chain, write information to the consumer and patient, briefing about the product details and their requirement, effects, side effects, and their digital marketing online and offline mode, which can be faster the product you reach to the public, compliance with the regulatory authorities with the promotions. So these are my closing thoughts. But Ayurveda bridging ancient wisdom with modern wellness with a healthier future, because we can give much healthier future to the patients and the people. But my sincere request by this platform to everyone, please plant the medicinal plants, and that will be helped in the future for the our only. Okay. Thank you one and all.
Thank you, sir. Now I would like to request Chairperson Dr. Rohit Gokarna sir to share their review.
Yeah.
Rohit sir.
Am I audible?
Yes, yes.
Okay. Yeah, I would like to appreciate Dr. Ajit Lingayat sir, who has covered almost all the areas which is required in terms of new horizons of Ayurveda industry. So he has touched upon to the standardization, quality control, proprietary medicine, classical medicines, research, which can be collaborated industry and academia collaboration, and he has also touched on to the personalized medicines, drug dosage modification, and almost all new drug dosage forms, which is requirement of today's era. So, which he has touched upon to the all the areas which were required to this topic. So, what I feel regarding the need of this industry or the new horizons is that contribution from all the stakeholders who are responsible, like each and every person who's contributing to Ayurveda, he has to feel that responsibility to bridge that gap. We have to collectively connect the dots to bridge the gap to bring about the globalization or the required authentication, evidence-based medicine in Ayurveda. So we feel as a academician, I feel that it may be my responsibility, but as a clinician, everyone or as a industrialist, so every person has his own responsibility to take Ayurveda forward. So as Sir described that the Ayurveda industry is somewhere around 16 billion right now, and 16 to 20 billion right now, and which is growing on. And there is a huge demand for Ayurveda products in global market. So what I feel is that it's not only what do you say, globalization, but also each and everybody's responsibility to take Ayurveda forward. So government is doing its part, as we say that any industry to flourish, Raja Shreya is very important, which has been said in our classics also. The similar way government is doing its part by promoting research, by giving enough opportunities to UG, PG students, giving enough funding in terms of extramural, intramural researchers, and even promoting Ayurveda in terms of the entrepreneurship level. So, wherein the students are motivated to do industrial or have an industrial experience in their student life itself, so that they can be good entrepreneurs or taking forward they can take a cue from Ayurveda knowledge and go and represent themselves as a industrialist from Ayurveda. Because many a times you feel that the people from Ayurveda are not much benefited in terms of what do you say, the benefits what they are getting in terms of revenue when it comes to the other people who have business ideas to take forward Ayurvedic ideas to industry. So this kind of idea or this kind of mindset should be developed in our students, so that they can take forward Ayurveda to a new level through industry or through their ideas with the Ayurvedic knowledge to a higher standards and higher globalization. So I congratulate all the members who have been contributing to this seminar and making like Ayurveda Teachers Association and ATCON 2024 for inviting me and inviting this lecture, which is a very important part of Ayurvedic industry for globalization. So thank you each and everyone for giving me opportunity.
Thank you, sir. Now I would like to request our co-chairperson, Amit Jain, sir, uh, to share their review. Amit
Hello,
Jain, sir.
hello. Am I audible?
Sir. Yes, sir. Yes, sir.
Uh, yes. Good evening to all. The session was superb, and Dr. Ajit Lingat sir has covered all the points, and he has told us about tradition, technology, innovation, and all the things to forward our Ayurveda industry. And I don't think so that any point sir has left. So I'm very thankful to ADCON team and Ayurveda Association team and to Dr. Rohit Gokarna sir. Thank you all.
Thank you, sir. With this, we come to end of this session. Uh, I would like to propose a vote of thanks for today's session. I am extremely thankful to Ayurveda Teacher Association for giving me this opportunity as a session coordinator. I am really delighted that we got to hear such an eminent speaker, Dr. Ajit Lingaya, sir. It is a very knowledgeable session. Thank you so much, sir. I would like to thank Dr. Rohit Gokarna, sir, who shared uh, its expert review. And I would also like to thank Dr. Amit Jain, sir. I would like to thank Dr. Amar Kamble, sir, and Dr. Sonia, ma'am. And last but not least, I am extremely thankful to all delegates.
I also thankful to
Sonia, ma'am.
AdCon team. I also thankful for AdCon team to invite me as a speaker and all. And as I'm a B Farm Ayurveda graduate and presenting here. Last 16 years I'm working with Ayurveda College. For all physicians I worked, all physicians are in front of me. Listen my words.
Thank you, sir.
And thank you very much for the
Thank you, sir.
giving opportunity.
It was wonderful to hear you, sir.
Thank you, sir.
Yes.
Thank you very much.
Sonia, ma'am. Hello.
Yes, sir. Yes, sir.
Yes, sir.
Oh, okay.
So after completion of this our last session, I thanks Dr. Lingayat sir, our speaker, for explaining this topic in the very depth and effectively, along with its future development and challenges faced while going through it. I am sure it will benefit the upcoming entrepreneurs and researchers of the field of the Ayurveda. So, and also I also thank Dr. Gokarna sir and Dr. Jain sir, as well as I thank our coordinators, Dr. Pardeshi ma'am and Dr. Waje sir for their nice conduction. So coming to the end of this today's sessions, here I want to express a vote of thanks. Thank the Dr. Shaha madam, Ramesh Kumar sir, Dr. Shetty sir, on behalf of Parvati Devi ma'am, Dr. Ajit Lingayat sir, for providing us the feast of the knowledge to our delegates. Then I thank all the chairpersons and co-chairpersons from all over the nation for declare here that our day first of this conference is over. Thank you, all of you. Thank you, one and all.
Thank you so much, sir.
Thank you.
Thank you.
Thank you, all of you. Thank you very much. So, so we are ending this today here.